Dear learners, welcome to segment 4.3 of module 4. Earlier you studied outreach in 4.1 and registration in 4.2. Now it's time to transition to the concept of payment mechanisms, and for that we will go through the segment of 4.3. So let's begin. Delivery mechanisms or payment systems are a critical element of social transfer programs. This video will discuss the challenges for a good delivery system along with critical policy decisions that need to be taken while designing it. We will also learn about two different payment approaches used in social protection payment. Further, this module will also provide detailed overview of advantages and challenges of different levels of government to person payments. Please pay special attention to the points discussed in the video, especially comparison between pull and push approaches, and also advantages and challenges of each level of G2P payments systems. So, bit of introduction about the payment systems. Provision of benefits and services is a key stage of the delivery chain, as you can see in this figure given on the slide. This module focuses on different mechanisms of provision of benefits. Payments is a core phase in the recurring implementation cycle, and often it's one of the main points of contact between a program and the people. And if you can see, we discussed these four pillars earlier: the pillar of assessment, enrollment, then provision of services and benefits, and then management. And if you can see, within the pillar of provision, the provision of benefits of services or how the payment mechanism is rolled out is of critical importance. Delivery mechanisms or payment systems are a critical element of social transfer programs because they absorb a high proportion of administrative burdens and operating cost and are therefore a key determinant of cost effectiveness and efficiency. Despite their importance, delivery systems often receive inadequate attention in the design phase. Once a decision is made to introduce a social transfer scheme, pressures to start disbursements as quickly as possible leave little time for exploring alternative delivery systems. And a default option is often adopted that requires little planning but might be inefficient and inappropriate. This is unfortunate, as problematic delivery system can cause otherwise well-designed transfer program to perform poorly or even fail. So the delivery system is very much prone to challenges. And what are these challenges? The goal of a payment system is to successfully distribute the correct amount of benefits to the right people at the right time and frequency while minimizing cost to both the program and the beneficiary. And this approach raises a number of challenges. And what are the shape and the forms of the challenges that can arise? The ideal payment system should be affordable and cost effective. It should be accountable and transparent. It should be reliable and accessible at low cost to recipients. The leakages should be minimized, and it should be secure against fraud, corruption, and theft. So the delivery of social transfers is more complex than it might appear, requiring at least 6 distinct policy decisions to be taken, which are who delivers the transfers, who receives the transfers, where are payments disbursed, how are payments disbursed, when are payments made, how often are payments made. So a combination of these who, where, how, and when, they actually matter in delivery system. And we will go through all the elements one by one in next slides. So in terms of policy decision for payments, the first question is who delivers the transfers. Options include government officials, NGO workers, post offices, or commercial banks. And this decision is as much political as it is technical, A government may choose to deliver benefits directly to boost its popularity, but a more efficient approach might be to subcontract private sector actors with special expertise. The second important question is who receives the transfer? And this is not a question about targeting, but about the authority to collect transfers. For example, grants targeted at children that are typically collected by child caretaker. Pensions can be collected either by the pensioner or by a nominated proxy. Transitioning to the next critical questions, where are payments dispersed? A distinction is typically made between pull and push mechanism of payment, and in this module we will discuss and compare both mechanisms in detail and at length. And then a bigger question, how are payments dispersed? What kind of tools or mechanism are used? And in this regard, options range from fully manual system, that is government to person transfer, where cash or commodities such as food are physically handed over to recipients, to fully automated system, that is G2P transfer payment 4.0, such as loading transfer directly onto mobile phones or into bank accounts. And again, in this module, we will discuss the evolution of G2P payments from the first pillar of G2P payments to the very refined pillar of G2P payments in detail. Next, we discuss when are payments made. This could be on a fixed date, let's say first Monday of each month, or it could be a rolling schedule with dates changing each time. With mobile delivery system such as social pension in Namibia, the dates when mobile units will visit each pay point are announced on local radio each month. Next, we have how often are payments made, and this question concerns the frequency of transfer payments. Monthly or quarterly is most common for long-term predictable transfer programs such as pensions or child support grants. Shorter periods are considered preferable for recipients, while longer periods reduce delivery cost to the provider. So out of these 6 policy decisions, where are payments dispersed and how payments are dispersed are the most critical question when it comes to designing mechanisms of social protection payments. So firstly, this module covers push and pull mechanisms of payments to answer the first question, and then we discuss all available methods of how G2P payments can be dispersed along with advantages. So coming to the concept of pull and push mechanisms, the payment mechanism in social protection payments are distinguished by pull mechanisms, whereby recipients are pulled to a particular pay point, usually a government office, bank, or post office, on a certain day, and push mechanisms, whereby the transfer is pushed electronically to the use of a smart card, mobile phone, or bank account, allowing the recipients greater flexibility about when they collect their transfers. Just delving deeper with both the mechanisms, pull mechanisms are appropriate in the context where financial infrastructure is lacking, particularly in rural areas. Pay points are often local government offices or mobile stations operated by local authorities or NGOs. And alternatively, post office may be used. In low and middle income countries, post offices tend to have wider coverage than commercial banks, especially in poor rural areas, and government favors them as delivery agents because they are fully or partly under state control. Post offices also tend to be preferred by poor citizens targeted for social transfers who tend to be illiterate and find bank intimidating and inaccessible. Contrary to pull mechanism, the push mechanisms are the ones whereby transfers made to recipients, usually electronically, can be accessed at any time using financial or technological infrastructure. A number of cash transfer schemes at both national and local levels have experimented with push mechanisms using a variety of innovative approaches. So both mechanisms, they come with certain set of advantages. However, there certain advantages of push mechanism over pull mechanism, and in itself it's a bit more effective. And these advantages are efficiency and cost effectiveness, flexibility, access to financial infrastructure, leapfrogging towards digital technology, multifunctionality, and minimizing the risk. And we will discuss each of this advantage to a certain extent. However, you can find full detail in one of the texts that is embedded in the platform concerning detailed advantages of push mechanism over the pull mechanisms. So the very first advantage is efficiency and cost effectiveness, and delivery systems that use push mechanism, they are better for governments and NGOs, especially in terms of personnel efficiency and cost effectiveness. And in this kind of push mechanism, staff are not required to disperse payments in person and are thus released to do important work that might otherwise be neglected. There's no need for transport, security, and insurance for the physical movement of cash to remote locations. And the risk of leakages through staff fraud is also substantially reduced. Now, coming to the advantage of flexibility, recipients of social transfers that are delivered through ATMs or mobile phones enjoy greater flexibility in accessing their grants. They are no longer required to report to a specified location on a specified date, with consequent savings on transport cost and the time lost in walking, waiting, and queuing. Third advantage is access to financial infrastructure. Push mechanisms invariably involve providing recipients with access to financial infrastructure such as mobile banking services, ATMs, and swipe cards or smart cards, all of which are inaccessible to most of the poor rural population, especially in Pakistan. So, access to financial services, even basic savings and withdrawal facilities, has been shown to reduce economic inequality and promote growth. So, this access to financial infrastructure, it actually provides opportunities for financial inclusion. So that is why it is one of the advantages that pertain to push mechanisms. The next advantage is leapfrogging the digital divide. So the use of technology in delivering social protection has social as well as financial benefits, as cash transfers are usually targeted at vulnerable groups, the older people, people with disabilities, women, and poor individuals. So these individuals are empowered through gaining capacity in the use of technology. On the macro scale, the use of mobile phones to transfer cash allows very poor countries to leapfrog the use of conventional landlines and go straight to satellite-based telecommunication systems. The next advantage is multifunctionality, and the multifunctionality of technology adds value by enhancing access not only to social transfers but also to a variety of goods and services from which poor people were previously excluded. Delivering social transfers through debit cards and bank accounts, as noted, gives unbankable people access to formal banking services, and we discussed this already at length. So next advantage is minimizing the fraud and the risk. So technology delivery systems are more difficult to defraud than manual delivery systems in many respects. For instance, bank reconciliation procedure require that every cent disbursed is accounted for under stringent banking regulations, making it harder for large sums of money to be illegitimately diverted during delivery. Also, information on recipient can include biometric indicators, photographs, fingerprints, optical recognition, which are recorded during registration and used for validation of recipients when they collect their transfers. Nonetheless, any system is only as secure as the information entered into it, And there have been instances of fraud on massive scale, especially on manual systems and lists when corruption entered large number of ghost beneficiaries. So in this regard, the push mechanisms, which are highly digitized and technology based, they do offer room for accountability and for curtailing the risk and the fraud in the system. However, it's not only the advantages that are outlined in the previous slide. The use of technology to deliver social transfer is also subject to a number of risks as well. As the use of technology to deliver social transfer is still a new idea, many of these risks are theoretical and potential, but they still need to be considered. Technical risk and ethical risk concerns attached to computerized information databases. The use of technology lends itself to public-private partnerships with government administering the schemes, government or donors financing them, and IT consultants or financial service firms servicing the disbursement. But this model raises questions about who owns and controls the information and who maintains responsibility for the database, which contains large amount of personal information that can be sensitive and potentially valuable. So there can be risk of political manipulation, like political manipulation could occur if, for instance, the databases include information on individuals based on ethnicity. Politically favored and influential ethnic groups could be targeted disproportionately for transfers, while ethnic groups that are opposed to authorities of the day could be systematically excluded. Also, there's a risk of commercial proprietorship. With any single platform technology, there's a risk that proprietor will indulge in monopoly pricing, or that something could happen to the proprietor, such as bankruptcy, that will cause the system to crash, leaving recipients unpaid and unable to access their social transfers. These risks arise from dependence on technology-based systems and are arguably less likely to occur with manual delivery mechanisms. Now we transition to evolution of government to person, G2P payments for social protection. We already discussed this idea in one of the earlier slides, and now we will be discussing it at length. So cash benefits are widely used for social protection, and there's an increasing emphasis on digitization of government to person payments to deliver safe, secure, swift and convenient payments in the context of catastrophes such as COVID-19 pandemic. And there are different levels of digitization of social protection payments. While most social protection programs tend to offer G2P 1, G2P 1.5 and G2P 2 payments, countries such as Zambia and Bangladesh are making the leap to G2P 3 and G2P 4. And the evolution from G2P 1 to 4 and beyond is not linear, and many programs and countries have coexisting modalities. Different levels of G2P payments and their key features are going to be discussed in the next slide. However, for now, I will just briefly explain what exactly these different type of G2P refer to. So when we talk about G2P 1.0, so G2P 1 refers to direct distribution of benefits from a single program to a single provider, where provision is in person. That is, beneficiaries queue in person to receive a cash payment. And provision of benefits in person continues to be offered by many programs, even in cases where other methods are available. Payments may be made through instruments such as cash. In some instances, biometric authentication may be used for proof of identification. Several developing countries use in-person cash provision as a mean of disbursing pensions, transfer payments, and social benefits much more often than high income economies. The usual motive is that financial ecosystem is not developed enough to allow the high volume of low value transactions at a reasonable transaction cost. Now, when we say G2P 1.5, it refers to distribution of benefits from a single program to a single provider, where provision is in person and electronically assisted. This is one program managed by one provider, and the provider is outsourced, such as commercial banks or mobile network operators. And in this format, beneficiaries queue in person to cash out, if possible, at agent, at the POS terminals, kiosks, and so on. And in one of the next slide, you can see the key features of G2P 1.5 and G2P 1, which are given in detail. Now, coming to G2P 2, this is actually single program to single provider. And G2P 2 refers to the initial stage in the digitization of payments provision, often through a single channel. And under G2P 2.0 approach, the back-end payments administration processes between social programs and payment service provider is digitized. Payments may be provisioned directly to a bank account or a mobile money account, offering flexibility as to when people can access or withdraw their money. Nevertheless, recipients can incur significant private costs to withdraw cash, as they may live farther away from a bank branch, ATM, or cash in, cash out agent. The G2P 2 model can improve the efficiency of payment provision, and if structured properly, can extend some elements of financial inclusion to beneficiaries. After G2P 2, G2P 3 comes, and this is actually single program to many providers. So G2P 3 refers to the digitization of payments from a single program to multiple providers, offering choice and convenience to end users. It allows for recipients to access payments from one or many programs through accounts and services providers of their choice. It allows them to switch service providers and transfer accounts based on their own analysis of cost and convenience. Governments can work with multiple service providers and offer larger transfer volumes, thus decreasing costs of provision and increasing attractiveness of the business case to potential payment providers. And this model offers incentives for greater interoperability among government institutions and service providers, thereby also allowing for a shift in the focus of the delivery system to a more human-centered approach, in contrast to the traditional approach of serving government agencies as the end user. So the human-centered design may allow for different solutions in remote areas or for clients with particular barriers, including sometimes cash payments where these are the most convenient. Thus, the G2P 3 model for social protection is somewhat aspirational for a number of countries. Beyond the efficiencies introduced in this model, the approach has also signaled the viability and desirability of providing choice and convenience to the poor through digitizing payments. And again, in one of the next slide, you can see the summary of G2P 3 and its key features. The last medium is G2P 4, which refers to the digitization of payments, enabling multiple programs to link to multiple providers through an interoperability approach. Many programs under one platform that can connect to the provider of choice. Beneficiaries can choose provider for each program, and transfers are virtual, deposited into a bank account or a mobile money account. And the objective is to provide the beneficiaries with the option to collect their payments anywhere at any time. And this contrasts with the closed loop electronic payment modalities that have proliferated across several countries, where beneficiaries need to collect their payment at a temporary payment desk during some specific date or dates. The idea is to enhance the beneficiary experience by using the national identification for authentication through the mapper to connect the beneficiary ID information to their respective accounts at the back end, allowing beneficiaries to withdraw their benefits at any commercial bank branch or mobile payment service provider agent or a government-owned post office. This also allows them to easily switch providers and accounts. And in one of the next slides, you can see summary of G2P4 and its key features.